Hi everyone, welcome to Pharmacology. So in today's video, we are going to see 50 important laboratory tests and their indications. So the first one is serum ferritin. It is indicated in iron deficiency, iron overload, inflammation. Then hemoglobin in anemia, bleeding. Hematocrit in case of anemia, bleeding, dehydration. MCV to differentiate between macrocytic anemia. Reticulocyte count evaluates the bone marrow function. ESR or erythrocyte sedimentation rate is indicated in case of inflammation, infection. CRP, also known as C-reactive protein, it is also indicated in case of inflammation or infection. White blood cell count in infection, leukemia, inflammation. Neutrophils in case of bacterial infections, inflammation. Lymphocytes as in case of viral infections, leukemia. Platelet count in bleeding disorders, thrombocytopenia. PT or INR, that is prothrombin time, or INR, that is international normalized ratio. In case of clotting disorders, liver disease, and warfarin therapy. D-dimer test is done in case of thrombosis, then DVT, that is deep vein thrombosis and pulmonary embolism. Troponin, it is indicated in case of myocardial infarction. Also, the CKMB, that is creatine kinase test, is also indicated in case of myocardial infarction. BNP or B-type natriuretic peptide is indicated in case of heart failure. Blood urea nitrogen or BUN. It is done to assess kidney function, then dehydration, GI bleeding. Serum creatinine in case of kidney function, then acute kidney injury and chronic kidney disease. EGFR or glomerular filtration rate to indicate or assess in case of chronic kidney disease. Then AST, which stands for aspartate aminotransferase, also known as SGOT, indicated in case of liver disease, hepatitis, muscle injury. Then ALT, which is known as alanine aminotransferase, also SGPT, it is indicated in case of liver disease and hepatitis. Alkaline phosphatase, in short form it is ALP, it is indicated in case of liver, bone disease, biliary obstruction. Then bilirubin total, it is indicated in case of liver disease, hemolysis, jaundice. Serum albumin, it is also indicated in case of liver disease, malnutrition, kidney disease. Serum ammonia, these tests are done in case of liver disease, hepatic encephalopathy. Amylase indicates pancreatitis, salivary gland disorders. Then lipase in case of pancreatitis. Serum calcium, it is done to evaluate or find out hypercalcemia, hypocalcemia, and bone disorders. Then phosphate indicated in case of kidney disease, hyperparathyroidism, and bone disorders. Magnesium to find out magnesium disorders, kidney disease, alcoholism. Then uric acid to find out gout, then kidney stones. Serum sodium to evaluate dehydration, SIADH, that is syndrome of inappropriate ADH secretion, then electrolyte imbalance. Serum potassium, as in case of kidney disease, then diuretic use, then acid-base disorders. Serum chloride is done in case of acid-base disorders and dehydration. Serum bicarbonate in acid-base disorders. Then blood glucose fasting is done to evaluate diabetes, then hypoglycemia. HbA1c or glycosylated hemoglobin, it is indicated in case of diabetes mellitus control. Then serum insulin in insulinoma, then insulin resistance. Serum C-peptide in case of insulin secretion, then diabetes evaluation. TSH or thyroid stimulating hormone to find out hypothyroidism and hyperthyroidism. Free T4 and free T3 in hypo and hyperthyroidism. Then anti-TPO antibodies. It is done in case of to find out Hashimoto's thyroiditis. Vitamin B12 in deficiency, then anemia and neurological disorders. Serum folate in deficiency and anemia. Procalcitonin to diagnose or to find out bacterial infection or sepsis. Then blood cultures to evaluate or it indicated in sepsis bacteremia. Then CSF analysis, that is cerebrospinal fluid analysis in meningitis, encephalitis. Then ANA, anti-nuclear antibody in autoimmune diseases. Then rheumatoid factor, it is indicated in rheumatoid arthritis, then autoimmune diseases. Then anti-dsDNA antibodies, it is indicated in systemic lupus erythematosus. So I hope this one is informative for all of you. So thank you everyone for watching my video. Thank you for your support. Have a pleasant day.